Hello, everyone. I hope everyone is doing well.
Hello.
Super excited to be here today and super excited for today's topic. I hope everybody is having a lovely, lovely Monday. Today, Servan could not make it. I think she's traveling, if I'm not wrong, but I'll be doing the session. Super chuffed with it. I'm just gonna wait maybe 1 or 2 more minutes because I can see that some people are still joining. If we want to maybe go around and introduce ourselves, if anybody wants to do that, in case we don't know each other.
All right, I can go ahead and introduce myself first. Thanks, Nala. My name is Doha. I'm a clinical pharmacist by training and profession. I'm also a cosmetologist under training. I currently work in one of the leading multinational pharma companies. So I basically work on the other side of industry.
Nice.
I really have a key passion towards the beauty and the aesthetic industry, which is why I'm undergoing the cosmetology training to be a cosmetologist. So always happy to be a founding member of Invicta Med and having that journey together and looking forward for more. Thanks.
Awesome. Thank you. Thanks, Dua. Perfect. Anybody else want to have a go, or we're good to go? Nope. Okay, cool. Awesome. So I am super excited to kick off the session then. What I'm gonna do is I will just quickly share my screen. So, in case anybody is new here, we are Invictamed. This is a webinar, one of the usual ones that we do in our member sessions. We do these about 2 to 3 times a month. We discuss a couple of topics surrounding social media, marketing, can be digital or non-digital. Today's exciting topic is about TikTok. Okay, revamping your TikTok game, of course, for clinics and clinicians. So today's discussion will surround more standalone docs rather than clinics, because I can see that the majority of the clinic owners that normally attend these sessions are not going to be with us today. So I have focused the discussion on standalone clinicians, or I suppose doctors in clinics. Um, just a heads up, if anybody has a question throughout the presentation, please feel free to stop me and ask any question that you want. Just completely interrupt. It's not a problem for me. Awesome. So I am not going to, one thing that I'm not going to do today is I'm not going to talk a lot of theory. Okay, I'm going to focus a lot of my discussion in practice, in practical. But to just get quickly the theory out of the way, just to prove to you that TikTok matters. Um, so patients are already searching your expertise on TikTok. This is a given. Okay, so much of the population, not just people in my generation, but people my parents' generation are using TikTok. I have personally worked with so many doctors who are constantly booking appointments and getting serious DMs on TikTok is the exact same as Instagram. You can make the same argument for Instagram that only teenagers are using it, but really it's just short form social media content. So this has recently become the new front door, okay, to your clinic or to your practice. It's a way to represent yourself on social media in a very, very similar way you do your Instagram. Okay, on TikTok, you want to build trust. You want to build visibility, and you definitely want to create credibility in just 60 seconds or less. Now, just to preface, TikTok can be anything from as short as, let's say, 5 seconds long, all the way up to 10 minutes. So it actually can also be long form. Today, we will be optimizing and focusing on short form rather than long form content, which is its own beautiful art as well that we can definitely discuss in another session. Now, to talk a little bit of numbers. So in the UAE alone, there's 9.2 million people who already have TikTok. So that is people of all ages, of course. We've got the youngest of the young to the oldest of the old, but around 9.2 million people have TikTok. That's around the same as the number of people who have Instagram, which is crazy to say, but as of this year, the numbers have gotten really close, and so TikTok and Instagram are really, really close competitors. So just like you focus on your Instagram game, you want to also definitely focus on your TikTok game. To wrap up the theory section of today's talk, okay, I'm going to give you my top three tips to how to create a successful TikTok account, okay? Give me 2 seconds. My screen has gone dark. That's really odd. Sorry, 1 second. Okay, we're back. Sorry about that. Okay. Okay, cool. Sorry. Back to the theory. So, to just quickly wrap up the theory with this final slide, I want to tell you that theoretically, okay, to build a very successful TikTok brand, you need three things. Okay, firstly, you need to pick a niche and you need to stick to it. Okay, so all of you listening today are medical professionals or work in clinics or in and around clinics. So essentially, usually every single clinical practice is going to be a wide practice, right? Let's say I am a GP, I'm a general practitioner. My practice is going to focus on a number of things, but a very successful way to niche, meaning to crunch down, is or to focus on a stream is, for example, let's say I'm a GP, but I have a special interest in skin and hair, or I'm a GP and I have a special interest in women's health, or I am a GP and I have a special interest in in pediatrics and children. And so what I'm going to do is, of course, while I do treat all of these other array of things, what I'm going to do is I'm going to focus the majority of my attention on my niche. So let's say I'm a GP and I really like women's health. What I'm going to do is I'm going to create themes of my content that are surrounding women's health, menopause, menstruation, etc., etc., etc. And this is just in the medical field. So let's talk aesthetics. Let's say I'm an aesthetic doctor and I do so many different things, obviously, but I am really, really focused on, let's say, I'm really good at jawline filler, let's say, and I focus a lot of my content on that. Or I'm really good at filler in general, I suppose you don't want to niche too much. And essentially, I'm going to stick to that. Why that works is because one, it makes it easier for me to conceptualize and strategize my content. Two, I will build a better community of people who are very much into what I'm doing rather than just kind of broadly talking about everything. And three, it makes my content more consistent. So I become known for that one thing that I really want to do. And in that way, it becomes, I would say, easier to, I think, build a funnel, build a funnel from the social media account all the way to booking an appointment and coming into the clinic. Tip number two is ask what's in it for me as the viewer. Okay, so when you create the content on TikTok or any really short form content, I'm going to ask what is in it for me. Okay, so if I were to be the patient and I'm scrolling by, um, am I gonna stop and scroll? Is there something that's interesting to me? Um, am I motivated to essentially stop my scroll and listen? And that kind of brings me to my third and final theoretical point. It will be to use and rely on hooks. Okay, that's the easiest way to make somebody stop scrolling. And I know that I have talked so much about hooks. I've talked about visual hooks, I've talked about text hooks, I've talked about verbal hooks, but I've talked about it very much theoretically. What I want to do in today's session is I want to go through different accounts on TikTok. Okay, that will be the focus of today's discussion. I want to go to very successful accounts and slightly less successful accounts, and I want to show you, I want to do a live comparison of what it is that has actually worked on TikTok. Okay, so rather than talking theory, let's actually go into TikTok and see what's happening on there. So let's jump right in. I have prepared three accounts, but I don't want to stick to just these three accounts. What I will do as well is I will go into the TikTok search bar and I'm going to write out keywords. Now, I've selected three accounts, three successful accounts into let's say, the poly practices or the three key practices in Dubai, which is medical, aesthetic, and dental. So he will be our medical guy. This will be our Oh, he's actually an anesthesiologist, so he'll be, I guess, our medical guy as well. And then this will be orthodontics, so this will be dental. So I want to start the analysis from the very top. Okay, I want to tell you what works well on an inst or on a sorry on a TikTok account when you look at it from the top section. Now you're gonna look at the picture here. It's a very clear picture, okay? There's a guy called Mr. Beast who you shouldn't look him up. He's awful, but he does a lot of research in what works on social media, etc. And one of the things that he found is that social media accounts tend to perform better when there's somebody very clear on the profile picture, so people know exactly what to expect. They tend to click more, they tend to stay longer, etc. The second thing that I'm gonna point out is his username. It's just Dr. Karen R. Okay, this is a very successful username. You want something very short, very crisp. Now, another example is this one who is, I actually don't know his name. I'm not sure what his actual name is, but his username is The London Dentist. Now, of course, this is an awesome name. This is a way better name than just Dr. Karen, because when you're looking at dentist and you're looking London, you might write Dentist London and he'll be the first one or among the first few to show up. Just because simply of his username. So you definitely want to use keywords in your username that people are using to look up your practice, but you definitely absolutely should not make it longer than one or two words if it wasn't your name. Really, if something like the London dentist is taken up, the Dubai dentist, the Dubai doctor, the Dubai beautician, if all of these are taken up, just make sure to put your first and last name um, in the username, and that should more than suffice. This one is called Dr. Myro, and that's just his name, so that works just as well. Um, okay. Now, the next thing is the bio. And actually, even though this is a very successful account, he has zero bio. So when I first stumbled on his content, I actually couldn't figure out what type of doctor he was. I had to go to one of the linked accounts, which is his Instagram account, and I had to essentially, yeah, find out that he's a GP. So this is not successful because, or not a good thing, or not a good practice to do because people on social media are going to be really, really lazy. Okay, so if they don't have something immediately at the tip of their finger, they're gonna lose interest and they're just gonna go away. And you're not making content because you're a content creator. You're a doctor, so you're making content for leads, you're making content spread information, you're making content to help people. So that's the last thing you want for people to just kind of jump on and out as if it's some sort of creator's account. Now, the next account that's quite successful is this one. I explain mind-blowing medical things. Anesthesiologist, weak stomach, don't follow. So this is very, very enticing. Okay, this is a very enticing bio. Now, is it a very professional bio? Is it something that's like, wow, I want to see this doctor so bad? Not necessarily, but is it that I want to watch his content and see what he's on about? I think so. The use of emojis is not something that love to do in bios, but it's not something I shy away from either. It really depends on what you're optimizing for. If you're optimizing for a very professional, clean look, emojis like these are not necessarily your best option. You can just give it a very, very clean and crispy kind of just tagline. You can use the help of ChatGPT to come up with that tagline. Just do the prompt of help me come up with a TikTok bio and ask me 10 questions for you to do it successfully. And then ChatGPT will essentially ask you 10 questions that would help it, yeah, come up with a really good and optimized bio for you. Now, the next one and the last one is follow me on IG for more Dentist of the Year winner 2024. Oh, okay. Sorry. So yeah, so fo follow me on IG for more Dentist of the Year winner 2024. And then it's his I think it's his email. Now, this is very straightforward. It's not very, in your face. Just follow me on IG, Dentist of the Year winner 2024. Of course, this is an amazing accomplishment that needs to be in the bio. Now, the thing about the one common factor that I can draw from all three, even though the first one is literally missing a bio, is the fact that all three are not old school. It's not like a very old school bio, like I'm a dentist and I do one, two, three. It feels very fresh, it feels very Gen Z, it feels very clean. That's essentially what you want on TikTok. You don't want that very old school, like boomer style of bios or content really, but so I would say something very clean and very crisp is very nice on TikTok. Try not to overcrowd the space and keep it very minimalistic. Now, the good stuff. Delving into the content, okay? Now we've checked out the profile, we've checked out the bios, we've checked out the usernames. Cool. Next, we want to look at the most popular videos that this doctor has, okay? And if you want to do this for your practice, so today we're going to be doing the research together, but you can actually do it completely by yourself. You can go to TikTok and you can go to the search bar and you can just look up orthodontics, for example. Okay, and you can look up top and it's gonna filter out for you the best content that's made in orthodontics. And you can scroll through many different videos that are, that have brought basically the maximum number of views. Generally, you want to look into the M's, the millions. So those are ones that have gone, let's say, quote unquote, mega viral. And essentially, what you want to do is you want to just kind of give it a scroll and check out what are the things that you can implement or you can take inspiration from. Now, the last thing you want to do is to look at other people's content and try to mimic it or try to do exactly the same. I have seen it time and time again. People will do it, it will fail, it will not perform at the level that these perform just because these are original pieces of content. So what you want to do is you want to take inspiration rather than copy. Now I'll come back to this page, but let's go back to this doctor. Let's go to the most popular stuff and let's click video by video and check it out.
Your life is a lie. Keep staring at the black dot in the center of the image, and I'll explain how your brain lies to you and constantly makes things up. As you keep focusing on the black dot, the cone cells in your retina become desensitized to the colors you can see and tones down the oranges and purples, and it will tone up the colors that are complementary to these. So when I change the image to black and white, your brain fills in the gaps with these complementary colors to maintain the illusion of normality. Your life is a lie.
Okay, so there's a combination of things happening here, and what I'm gonna do is I'm gonna go through every single video and I'm gonna explain what are the successful hooks used here, what are the things that could have been better if there are things that could be better. Now, there's a bunch of things happening in this one video. This video got, what was it, 40 something, 40 million? Yeah,
Your
41
life is
million views. 41 million views, 41.6 million. So there's a bunch of really awesome things used in this video, of course. The number one is we hear a verbal hook. I'm gonna play it one more time.
A lie. Your life is a lie. Keep staring at the black dot in
Your life is a lie
your life
is immediately a super strong verbal hook. If somebody says your life is a lie, you're like, huh? What do you mean my life is a lie? So it's immediately scroll stopping. The second thing, the second awesome thing that we see here is something called a text hook. Okay, so that's when you write a line at the top of the video, and it tends to basically what it does is it stops people from scrolling because people are busy reading it. So it stops people for that one extra second that you want. Now, the second thing is you see something called part one. So this is a series. Okay, so what happens on social media is people become really excited about series because I'm not sure what it is exactly about series that makes them perform, but it series tend to be successful in doing three key things. One, okay, people feel that they are part of a journey with you, okay, so they're much more likely to actually go into your page, stalk you, and probably even give you a follow, okay, so number two, it builds your followers. And number three, if let's say you get to episode two or episode three, and it's the first time that somebody is seeing my content, so it says, Your Life is a Lie, part three, people are much more likely to actually go into your account, go to part one, go to part two, and start at part one. So they're much more likely to give you views for the account as a whole rather than just that one video. So part series are awesome. Okay, now let's continue into the video.
is a lie. Keep staring at the black dot.
Okay, so now even though his content technically, okay, isn't optimized for social media, okay, so if you were to work with an agency or something, they probably would not put a picture like this in the middle like this, okay? But what happens when you make content that kind of looks quote unquote bad, okay, it actually sometimes tends to work better on social media because people don't feel that they're being sold something. All right, so what happens is it kind of feels authentic that the doctor is actually taking time to do this. And if you actually are taking time to do this, it works to your favor because these are much easier, obviously, to edit. Okay, so that was
Your life
that video. What can you take from it? Okay, a very strong hook. Your life is a lie. Very strong statement. Yeah. Scroll stopping, it really kind of demands attention. It demands respect because this person is just making a really strong statement. Takeaway number two is parts. Okay, so maybe if you were an aesthetic doctor, you can say something like, you are getting older and you need aesthetic treatments, part one. Or you're getting older, how can you age better? Part one, etc. Okay? Number three is the use of, say, non-optimal editing, okay? Editing that just kind of looks quick and effortless. So don't feel that you have to go after your marketing people to fully optimize your content. Sometimes this level of content or this level of editing tends to work better. Now we can go into another video. Let's go into this one.
This is why you should never kick someone in the nuts. A sudden forceful trauma to
Okay, sorry for the slightly graphic topic, but I want to bring your attention
this is why
back to the beginning of the video, the hook. So, okay, there's a bunch of things happening in his hooks, okay? Number one, he's using an image in the background, okay? An image representing exactly what he's saying. The image is skewed to the top, okay? And then it repeats down here, so it creates this really interesting texture at the bottom. Number two, he's using a green screen. Now, a green screen, and it's something that I did a tip on, I think a couple of weeks back, or a couple of weeks back, like 2, 3 weeks back, on how to actually do a green screen. What happens with a green screen is that it looks very authentic. Again, it looks like the doctor is actually making the content, so it feels much less salesy than any other style of content. Now, Another thing that he does here is he uses, again, these text hooks, okay? Never do this, okay? The fourth thing that he does in his hook is he says, this is why you should never kick somebody in the nuts. This is why. So when you say this is the number reason. Oh, sorry, this is the number one reason, or this is the reason. When you say this, it creates that curiosity, like, oh, what is this? And then, of course, the choice of the very, 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 very gruesome topic, which, of course, will definitely get views, but this doesn't necessarily relate to many of you. But this is a very, very, very successful hook. So I guess so far, what we see in his style of content is that he really uses a combination of many hook theories. It's not that he just has a really successful text hook, and it's not just that he has a very successful verbal hook. It's that he has a combination of these things. Let's check out one last video from his account. Let's go for this.
I'm just saying, if I'm not supposed to put
Oh,
I'm just saying, if I'm not supposed to put cotton swabs in my ears, then why did evolution put a happy button in there? Oh.
If this happens to you, you're having
okay. This is my favorite way to false engineer a trending video. So what you do is you essentially find videos that are already trending on social media. And what you do is you kind of steal them a little bit. So you essentially you take something as trending as this video, which already has an optimal hook. Okay, so it's UGC content, which means user generated content. So it's somebody that's just kind of made it. It's not really for the doctor that the video was made, but the video blew up. Okay, the video got millions of views and it performed really well. So what you do is you use the fact that it blew up to your advantage and you use it in the beginning of your hook. So you kind of use their hook for your hook. Okay. And then you use a very small icon of yourself, I guess, and you come in as a green screen. Okay. So we'll start again.
Hey, medical bills on my. I'm just saying, if I'm not supposed to put cotton swabs in my ears, then why did evolution put a happy button in there? Oh.
If this happens to you, you're having an ear boner. The happy button.
Okay, and then he also definitely uses that light language, of course. Okay, maybe as a doctor, you're not gonna say boner. He does, but you probably won't. But you can say something as outrageous as that if you want. I mean, it doesn't get taken down. I get that question a lot. Can I use the F word? Can I use the S word? Can I use whatever word? You can use whatever you want on social media. That's not to say that you won't get shadow banned if you overdo it. You might. But with my clients, I've used bullshit, the F word, S, all of the above, and it works perfectly well. It just depends on how you want to position yourself. If you want to position yourself as somebody who's very, very polished and very quote unquote professional, then maybe it's not the way to go. However, I have seen that the more authentic, the more real, and the more you are on social media, the better it tends to perform. Now, his style of stealing somebody else's hook or false engineering a viral video has been done again in his other viral video here.
I've been paying medical bills on my son for 9 years since he was born. And he was just diagnosed with type 1 diabetes. And I said,
So here he takes a slightly different approach. Okay, he reacts to the video as it's happening. Reaction videos tend to perform so much better than even the regular videos themselves if the topic is interesting enough. Because what happens when you scroll or when you are a user of social media is you actually kind of rely on the opinions of others. So even me as a user, when I'm scrolling on TikTok, what I do is in almost every single TikTok that I watch, I'll go to the comments section and I'll start reading what other people think. So that's why reaction videos tend to work really well. It's like the psychology of how people use social media, but essentially, people want to know what you think. They've seen this video. This is a very viral video. Maybe they've seen it and they've already kind of made their own thoughts, but people love to hear what other people have to say. So it's a really good idea to actually green screen an already viral video and be on the side of it, kind of just reacting, nodding. And by the way, there's some personal accounts that literally make content just like this. They don't even talk, they don't say anything, and they get millions and millions of views by just simply being on the side of the content and they're just nodding. So this is a really, really successful way to engineer a viral video.
Insulin every 2 hours. I just got his prescription. It was $1,000. I can pay.
See, and he doesn't shy away from keeping it really long, also. A lot of people are like, oh, no, I'm stealing the whole content, I'm just stealing her video, I'm just nodding to the side. Well, guess what? That's part of what works sometimes. So, look, I wouldn't say do it for every single trending video out there, but if there's a trending video that is um compatible to what you do, 1000% go for it. I think it's a great way to yeah, I mean, engineer good performance. Cool. Does anybody have any questions regarding this account so far or anything that I've mentioned so far?
Do you hear me?
Yes, I do.
Oh, thanks. So perhaps I think that in terms of number of followers, it's clear that he has over 5 million followers, which apparently is great. Any idea on the actual performance of this physician? I mean, in terms of business, or is he more as a funny content creator? Because I don't know where he operates in as a country, but I would imagine that if his profile is here in the Middle East, I'm not sure he would be very well doing in terms of business because sometimes this profile is not very well respected within the society as a medical profession, let's say. I mean, it's funny to watch content, but I mean, if it personally, and that's me, I wouldn't go to a doctor with that personality. So just food for thought here.
Yeah, definitely. Thank you so much for that. And if anybody wants to add to that as well or rebuttal, feel free to. I'll say my opinion as a marketing person who has worked with clinicians building their personal brand on social media. You would be shocked at the types of people that patients tend to go to. So, generally, as a rule of thumb in personal branding, what we accept to be the truth, and perhaps it's not the truth for everyone, but in general, as a rule of thumb, people will trust and go to people that they know. Okay, so even if you think, yeah, maybe people don't respect him because he does really fun, quote unquote, funny hooks or social media content, but what happens is when I'm in trouble and I don't know who to trust, I'm gonna go with who's familiar. I'm gonna go for somebody who I've seen on social media, somebody who I see that other people follow and tend to love. That's number one. Number two, what happens when you build a really, really, really strong personal brand on social media, be it through the funny route, through the serious route, through the whatever you choose to build it on route, is you sometimes build this cult-like following. Okay, I've seen it happen before, where a doctor is just really cool on social media, and people are like, "Oh yeah, he just seems like a cool guy, so I'm gonna follow him wherever he goes." So I know that, especially in the Middle East, you're right. People tend to shy away from this type of content, but really it does perform really well, and it does invite people to come. I've never seen somebody work on their personal brand in the correct way and not succeed in building their practice.
All right, thanks. It's surprisingly, it works.
Yeah, 100%. So, we have got Dr. Myro next, okay? Anesthesiologist. So let's go to some of his popular videos and see the stuff that the hooks and why the video is essentially performed. Now, I want to also say something. I'll preface this account. I'm not saying that this is good social media content to make. I'm just saying sometimes going to the accounts that are mo the biggest on social media is an indication of what people are liking. Okay, it's an indication of what works. It doesn't mean that you should be, Mr. Funny Guy or dance or start doing trends or any of this stuff. It's definitely not something that I would recommend. Please don't do trends. They're super cringe. But these are kind of indications to what works on social media. Okay. So, for example, with Dr. Karen, I would not recommend you to say things like ear boner and these, gruesome things, but we should take let's say a learning from why his videos worked. Like what I was talking about with the text hooks, combined with the verbal hooks, combined with the trending video in the background. So these are all things that can be done in a very polite and nice manner as well, with trending content in the back that isn't gruesome or isn't rude or isn't quote unquote funny. Okay, let's go to Dr. Myro. We've got 50 million views on the first video.
Abandoned mansion and a pool he jumps in, except it's a perfect breeding ground for brain-eating amoeba.
The neurologist came in and told us 4 days. You have 4 days with your son. From baseball in summer sand to
Okay. This is one of my favorite types of social media content. This is called storytelling. Okay. You're essentially taking a real life scenario. It's like true crime type of vibes. Okay. You're taking a real life scenario that actually happened that pertains to your medical niche, and you are essentially telling the story. And it doesn't have to be done in the way that he did it, but I'll remind you how he did it.
Abandoned mansion and a pool he jumps in, except it's a perfect breeding ground for
That's a great way to start, okay? But that's, I would say, a slightly more advanced way of storytelling, okay? Um, I forgot again what he said, but yeah, abandoned pool and a ta ta ta. Like, it doesn't have to be done in that way. I'll give you other examples of how to kind of start storytelling in your content, okay? So let's say I am a dermatologist and I have a patient whose skin maybe got I don't know, she got a really bad rash, okay? And let's say that rash got worse over 6 months. I'm gonna say, how did this patient's face go from this to this in 6 months? And then I'm gonna tell the story. It all started with a tiny rash on her neck, and she would itch and scratch, and at night she would da 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 da, and then you go for it, okay? And you tell the whole story of how this thing came about. And the reason why storytelling works is because, I mean, it's the same as asking why do movies work? Why do documentaries work? People love a story. It feels inviting, it feels good to listen to a story, it feels comforting. So I would 1000% recommend to start storytelling a little bit in your content. And the more videos and pictures you can back it up, like in this case, the better. And the more viral and well known the story is, and if you have your own personal take on that story, the even better. A lot of the time, people are like, oh, you've seen this, and let's just talk about it immediately. No, instead, if there's a viral story that you want to tell in the back, tell the whole story. Be the person to bring attention to that story, and try to do it in a very engaging way by being a green screen like he is. Now, you'll notice that there's quite a few commonalities between people who trend a lot. They'll have lots of really common patterns that they do in their content, which one of them is using a green screen. Number two is using viral content in the back to false engineer virality. And number three is using text hooks at the top as well. Awesome. Let's go for another one and see what he did successfully as well.
Yep, that's me. You're probably wondering how I ended up in this situation.
accidental bleach inhalation cleaning. My bad.
Okay, so very similar here. He's taken an already edited and viral piece of content, and he's literally just stealing it in his content, putting it in the back, and he's making crazy faces. Okay, again, for the sake of building a respectable medical personal brand, you don't have to be like, making all these crazy faces. it might invite a few more views, but it doesn't necessarily mean that you're gonna be working towards the target personal brand that you want to build essentially. So instead, you can just hold your phone and react normally. It doesn't have to be insane like this, and then you can just talk about it in a very professional way. Cool. Let's look at another piece of content for this creator or this doctor. Mm-mm-mm. Mm-hmm.
When the scalpel cuts you, it doesn't even hurt. It's so sharp, it cuts cleanly across nerve endings. When the scalpel cuts you, it doesn't even hurt. It's so sharp, it cuts cleanly across nerve endings.
This is a super piece of content. Okay, let me see how many views it got. So this got 22,000 views, and it was what?
This is
Oh, not this actually, sorry. Oh, this got 2.5 million views. So this is a type of content, okay, that is super, 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 super short. Okay, it was what, 4 seconds, 6 seconds maximum. But it acted as a very shareable fact. Okay, so a lot of people will ask on social media, Quora, Yahoo Answers, Reddit, they'll be like, oh, how does a doctor cut through your entire arm and it doesn't hurt, etc. And so he essentially made a very, very, very tiny fact, okay, or said a very tiny fact in a very tiny amount of time. And he just said,
cuts you, it doesn't even hurt. It's so sharp, it cuts cleanly across nerve endings.
okay, now you can make these types of facts about really anything in your field that patients will ask you about. And this is the telltale sign that something will perform. If your patients in real life are already asking you questions about these things, this is probably a good sign to make a video about it and to make a very kind of short, tiny, fun fact like this. Okay, so that's one of the reasons why it went viral, because of how short it is. Okay, so it keeps repeating and repeating and repeating. Number two is he's used a picture in the background to show what he's talking about. Or not a picture, sorry, a video actually in the background to show what he's talking about. And what he's done at the same time is he's made himself the green screen again. So this is a really, really, really powerful way to false engineer, or to engineer, I suppose, a viral video. The only thing I would do different here is I would probably add a text hook here rather than just a small text in the middle. I think that that would have blasted it even more. But yeah, this is an awesome piece of content that we can definitely take some learning from. Quick fun fact. You can ask ChatGPT even to come up with really quick fun facts about what you do. These types of videos take what, 2 to 3 minutes to make, and you can put one out a week, even, and you can literally film it on your phone. One tiny note here that I notice a lot of.
What I do.
Sorry.
When the scalpel
Another quick note that he does in his videos a lot is he holds his mic. So you'll notice that a lot of people will hold their mic rather than just have it, put on their shirt. And the reason why is because this is called a visual hook. Okay, what happens is when the speaker in the content is holding something in his hand, what happens is it actually acts as a curiosity builder. So people are like, oh, he's gonna drop it, or he's gonna, oh, what was he holding? It just adds that one little tiny second of thought extra about the video, and it just might stop them from scrolling. So this is a really successful way of hooking people in just with that little bit extra tiny piece of attention. Now, a lot of people will do this with the mic in very funny ways. So they will use a fork to attach the mic on. They'll put it on bread. They'll put it on plates. They'll put it on really anything to just kind of grasp your attention. Okay, I think that's fine for this doctor. Does anybody have any questions as of now, based on this account or based on anything that we've discussed so far?
Perhaps the question here, Nahla, if I would understand. So you're saying that yes, he's really getting a large number of views. You said one of the secrets is that the videos are extremely short. Is this what you think is the most attractive element to it?
It's not that it's the most attractive element of the video, but I would say the most successful way to build a brand or a personal brand on social media is variety. Because you want to test out what works for your audience. But I think that a combination of, let's say, slightly longer but also very short type of content is optimal. So I would not recommend to do all 4 to 6 second videos because that just won't work as well to build the brand that you probably want as a clinician, right? I don't think patients would come see you just from 5 second videos, but it does act as that added exposure, right? So a short video is much more likely to repeat. Okay, so somebody who's watching is able to watch it again and again and again and again and again, and basically every single time that they watch it, it acts as an extra view. So it definitely garners views and attention, but it's not necessarily the best um type of video to make for all the content that you make.
Okay, great, thanks.
Yeah, 1000%. Cool. I think that's fine. I actually don't think we'll have time to discuss this doctor, but he's also a great example, especially if we have any of the dental crowd here. So definitely do look him up, the London dentist. I can maybe discuss him as a tip of the week later on in the week as well. But he's got some really, really awesome content. I just want to spend a little bit of time on this. So this is how you essentially look up what trends in your practice. So let's say I am a spine surgeon. I will look up spine surgery. And I will see what is trending in my practice. Okay, so generally I want to go to the million views ones and check out what others are doing. Okay, so this is obviously very hard to recreate because it's the actual patient. So I would skip that one. I'd only watch ones that are relevant to me. So again, I'm looking for that million views.
People always ask me why I wrap my wrist like this, like a hazmat person. And it's because
So what works really well in this content is that obviously we are in an OT, okay? We're in an operation room. I've never done a video in an operation room and it didn't do well, I don't think. So people are very curious what happens in the surgery after I go under. So I'm not so sure if this is so relevant to all of you, but this is, if you're a surgeon, definitely film your surgeries, okay, if you can. Don't get sued. And then also you can also see a visual hook, right? So if I am a non-surgeon, or if I'm not a surgeon and I'm a doctor who's about to maybe put on gloves, and I'm going to talk about why I wear gloves or why I wear black gloves or pink gloves or blue gloves or whatever type of gloves I wear, a great visual hook would be to be putting them on with some noise and a little bit of aggression, okay? That's really kind of scroll stopping. That little bit of noise and that little bit of bigger action, it really it demands people to kind of stop scrolling. Cool. So you can literally look up here anything spine surgery, Botox, orthodontics, uh, anything, women's health, doctors, Dubai doctor. What I would generally stay away from is trying to, again, copy content that other people are making. It just won't work as well. It won't sound like you, it won't look like you, and it won't build your personal brand because a personal brand is supposed to be personal, of course. Now, to spend the last couple of minutes just kind of going over a couple of questions that some people had left in the group earlier today. Is TikTok only for teenagers? No, TikTok is not only for teenagers. TikTok is for everybody, um, from the youngest of the young to the oldest of the old. My parents are on TikTok now, so and my mom barely knows how to use iPhone, so TikTok is for everyone. It's essentially at its core, it's an entertainment social media platform, just like every other social media platform, same as TikTok, or sorry, same as Instagram, same as Snapchat, same as everything else. It's really a form of escapism, that people are logging in to get away from their lives, get away from their stressors, and just kind of forget about everything for a moment. But it still is a great advertising platform, okay? Not just for teenagers, for everybody. How do I make my account look professional? I think we more than covered that today. Be crispy, be fresh, represent yourself in the way that you know you want to be represented. Stay away, though, from things that are too formal and too polished and just so clinical. You want to, I think somebody's left a chat. Okay. I don't have the age split. I will look that up and I will put that in the WhatsApp group, the age split for TikTok. So yeah, you don't want to do that super like clinical look of we look the same as every single clinic in Dubai and we're this blue and white clinic. You want to look a little bit different. You want to be fresher. You want to look cooler than everybody else to stand out, but you still want to retain your professionalism as a medical professional, of course. How often should we post, and is it different from Instagram? Isn't Instagram enough? Okay, that's two questions. So, how often should we post? Okay, actually, it's three questions. So, firstly, is how often should we post? Okay, generally, I would recommend anywhere from 14 to 15 times a month is a good start. Well, it's good in general, not a good start. I think a good start would be once a week, definitely if you're a little bit shy or you don't know what to make it on or you're not 100% sure how to strategize the content. I think definitely once a week, twice a week is a great start, but overall 14 to 15 is awesome. Is it different from Instagram? It's different in the sense that it's literally different. It's a different platform. But if you mean by is it different from Instagram, is the content optimized differently? No, short form content on social media is short form content on social media. So if it works on Instagram, it should work on TikTok. If it works on TikTok, it should work on Instagram, on YouTube Shorts, on Snapchat. People are people everywhere and they're scrolling, and you want to, create scroll stopping content that makes them stop scrolling. And it's the same strategies everywhere. And isn't Instagram enough? The thing about Instagram is that it is enough. I mean, it's a great hub for clinicians and clinics, but it is a saturated market. Okay, it's generally easier to perform on TikTok because one, it's less saturated, and two, people have, as of last year, historically spent more time using TikTok than they did Instagram. So, and also, like I said, the type of content that you're making on Instagram is already optimal for Instagram. So why not just post it on TikTok as well? I think that would just kind of make sense. To also integrate TikTok because it's another form of exposure. It might reach people that you can't reach on Instagram. So why not try it? Lastly, which different target audience and engagement can you expect to have between Instagram and TikTok? So the target audience between Instagram and TikTok is again relatively the same because it's the same types of people. What I would say, or what I have noticed, and this is anecdotal, it's not empirical. No one's looked into this. I really did chat GPT it before the presentation, but there isn't enough information. But I have seen that the audience, especially in this region on TikTok, is a little bit more Western than they are, say, Eastern or Arab or Asian, than they are on Instagram. I've noticed that a lot of, for lack of better words, a lot of white and Western people are on TikTok, and a lot of Arabs, Asians, etc., are on Instagram/Facebook. And I'm not 100% sure how or why that evolved in the way that it did, but if you are looking to target more of the Western population, I have seen that you can reach them a lot easier on TikTok, especially if you use, certain types of tonality and a certain level of authenticity. And if your content resonates with that population, you're much more likely to find them on TikTok than you are Instagram. So that's just something interesting that I've noticed. Other than that, I'm not so sure that there is much of a different target audience or engagement that you will find between Instagram and TikTok. Like I said, short form content is short form content everywhere. So as long as you optimize for performance for any type of short content, you should perform on both Instagram and TikTok. Awesome. That would be all from me for now. Thank you, Dr. Sharif, for that. Does anybody have any questions so far based on what I've discussed, or any comments to add based on anything that I've said?
Thanks, Nahla. Been really great.
Awesome. Thanks, guys. I think that's fine then. Wrap it up.
It's good. I have one question. As you mentioned that the content should not be repetitive, but what is your take on using the trendy audios or trendy, mostly audio, right? Trending audio. How do you incorporate that as part of your video and do you make it differently?
Yeah, so in terms of trending audios and stuff, that used to be more of like the old school way of thinking about virality on social media. We used to think that, yeah, if you use like trending audios and do the trends and use hashtags that are trending, that it will boost your performance. Turns out that none of that stuff works. Really, what works is good content. So if you've got content in the back of your video that's really awesome, or you're an awesome content presenter, that's really what works. It's not really the hashtags or the sounds or any of that stuff that we used to think worked.
Yeah, makes sense. Yeah, because that's how it will relate to the hook part of it, which is related to your
Yeah,
business.
exactly. Right on. Exactly.
Thank you so much. No, it was very good. And in our clinic, I think we get more conversions from TikTok. There are more positive conversions
Yeah.
that happens versus Instagram. So if we get leads through Instagram, there's a higher probability for them to convert.
Yep.
Means they are serious buyers, I would say.
Awesome. Awesome. Yeah, that's really good to hear. Awesome. Thanks, guys. I'm gonna head off for the night then. Thank you so much for listening and being here, and I'll see you next time. Thank you.
Thank you so much.
Thanks. Bye. Bye.
Thanks, Nahla.